What made you choose spine surgery so that you can just tell people, I've got your back?
Everybody gets back to pain. కట్స్ వచ్చేయాలి, 6 packs వచ్చేయాలి అనేసి జిమ్ అంటే వెళ్ళిపోయామా, ఒక 100 కిలోలు ఎత్తామా, దట్ ఈస్ వెన్ యూ డెవలప్ అ ప్రాబ్లమ్ కాల్డ్ as Tex neck syndrome.
He might need surgery, or he might need some patience, or he might need some physiotherapy or some pep talk. How do you decide? So, welcome to the program, Dr. Madhu, and it's a pleasure to have you here.
Pleasure to be here, Dr. Lakshmi.
So, tell me honestly, what made you choose spine surgery so that you can just tell people, I've got your back?
My basic training is in, after my MBBS is in MS Orthopedics. So after orthopedics, from the beginning, I was always interested in fine surgeries, and also I had a very good trainer in my college days. And I was always interested in how the spine works. And it's always the back that is more important. And many of the people who have pains are more associated with your spine. So this made me more interested into spine surgeries.
But don't you think spine is supposed to be very supportive and strong? But why do you think it sometimes acts like the drama queen? Do you think it's...
Yeah, what you have said is absolutely right. The way that human beings were supposed to be was, you have to always fight for your food and always be active.
On the go.
Yeah. So as humanity had progressed, so what has happened is people have started becoming more lazier. Yeah. And our lives have become more comfortable, and the food is brought on a plate to us. And as time passed by, we have stopped strengthening our backs. So there's your answer. Rather than becoming the hero, it has become the
Lazy
drama
couch
queen.
potatoes antara.
Definitely. That is another term that can be used for.
So why do you think, most of us, almost, we have back pain or spine issues at some point or the other in our lives? So why do you think this is happening? Ante idi ippudu common ayinda leda intaku mundu undinda? Like, what are the issues contributing to this antaru?
Everybody gets back to pain. There is no two ways about it. So the thing is, back pains are always common, but it doesn't mean that these back pains will always tend to become severe at some point in time. So most of the times, these back pains need to just be addressed by just general exercises, keeping your back fit, and doing decent amount of workouts. All these things will contribute to improvement of your back.
So when someone says, oh, it's just a little back pain, so does that cringe you?
No, not exactly. Actually, when someone says, yeah, I had some amount of back pain, that is a normal thing. Being born as a human being, you need to have back pain at some point in time in your life. So, a little back pain, you don't have to worry. So, you just need to go on with your daily life. You just need to, as I've already told you, you need to get your back strengthened.
So here comes the question. When do you think one should consult you or a spine surgeon for back pain or any spine issues? As you said, back pain is normal. You don't have to worry about it all the time.
So if you see back pain, you can divide it into two parts. One thing is just mechanical kind of back pain. And the other one is a back pain which is caused by many pathological reasons. So mechanical in the sense like, you lift some weight, maybe you just get some amount of back pain. All that you need to do is rest. But when do you need to see a doctor? When do you need to see a spine surgeon per se? Is when this pain does not reduce, or when this pain progressively increases, or when you think your pain is so severe that it is not even letting you do your daily activity.
But usually, ఇంతకుముందు back pain ante they think it's mostly associated with older age group people. But don't you think young people, teenagers, they're also getting affected with this, and also the ID people? Why do you think?
Now, what has happened is most of our population is more of like a couch potato. Okay. Or there is too much of heavy lifting that's involved. And the other reason is abnormally doing your gym. Yeah. So, strengthening your back and strengthening your core is very good for you. Whereas when you totally become like, you want to develop these biceps, అంటే చాలా ఈ కట్స్ వచ్చేయాలి, 6 packs వచ్చేయాలి అనేసి బాగా జిమ్మింగ్ చేసి, అంటే gym
Without
is always
proper
good. Yeah,
trainer
without
or
proper training
assistance,
and
yeah.
without proper nutrition acts in a big way.
Oh.
So all those things have to be taken into consideration. జిమ్ అంటే వెళ్ళిపోయామా, ఒక 100 కిలోలు ఎత్తామా, అట్లా. That is not the way that is supposed to be done. You need to progressively develop your strength. Whereas, say, like IT professionals, ఒకసారి కంప్యూటర్ ముందు కూర్చున్నారంటే they are there for like hours together. That is when you develop a problem called as text neck syndrome, and it's actually a term that is there. So ఏంటంటే your head weighs around 5 kgs, okay? So as you keep flexing your neck, that is when you keep bending your neck, every 10 to 15 degrees, your neck exponentially increases in weight. That is 5 kgs అయితే 10 kgs అవుద్ది, 10 kgs 20 kgs అవుద్ది, అట్లా it keeps
This
going.
is an
So,
interesting fact, actually.
yeah, at 70 degrees, it's almost like 25 kgs, and your disc is so small, అంత వెయిట్ అసలు క్యారీ చేయలేదు. At some point in time, it is going to give out. So that is how చేతులారా చేసుకుంటా ఉంటారు కదా. Most of the spine problems, that is the neck or the lower back, is what constitute almost around 80% of the whole spine problems.
I think that's rightly said, because sitting is the new smoking, antaru.
100%. I
Yeah.
totally agree.
So is there any right posture, antara, while sitting, or what are some tips that you would like to give to the working people out there?
Posture ఏంటంటే sitting has to be done in a proper. They also need to have, right now I'm not sitting in the best of the chairs, but ఏంటంటే you need to have an ergonomic chair. Yeah, that is the first point. And the second point ఏంటంటే you will have to sit completely back. Yeah, and your back has to be supported, and always sit a little forward rather than just lying down like that. Yeah, and the most important thing is, do not slouch. ఏంటంటే ఈ స్లౌచింగ్ అంటే ఏం లేదు, కాస్త ఇట్లా జారిపోతాం. So those things will give rise to back pain and things like that. Every half an hour or 45 minutes, okay, 2 minutes, just take a walk. You need to take care of your back if you have to excel in your IT and everything.
And following such simple tips can save your back and get your back a long way, I guess.
Yeah.
So apart from, sitting wrongly or sitting for a long time, are there any other daily habits that would be wrecking our back without knowing us?
From the time a person wakes up. So what you need to do is, first thing, as soon as you wake up, just don't drop up like that. Turn to your side, take your time, and then just wake up in a proper manner. That is on the lateral position. You can just wake up, just move your arms and legs, just try flexing and extending slowly. And then if you could go for, say, just 25 minutes to half an hour of your cardiac exercises, and also not only just cardio, a little amount of isometric strengthening exercises will take your back a long way.
So when someone comes to you with back pain, doctor, how do you decide he might need surgery or he might need some patience or he might need some physiotherapy or some pep talk? How do you decide?
Nowadays, what people do is uh, they tend to take an MRI even without a doctor's prescription, and they come off with an MRI to the OPD. MRI is not required in most of the patients. So when you consult the doctor, when we see a patient, first we examine them clinically. So we give the medicines accordingly, and also physiotherapy, back strengthening exercise, and all these are given. But when talking about the remaining 5% to 5% of the population, what we do is we first take an MRI, and then we see what kind of a prolapse it might be. They are different types. It could be either mechanical, that is because of the pressure falling on the nerve, because of the disc prolapse, or if the spine has moved forward, or there are other reasons. They could be a tumor, or they could be an infection, or they could also be some other structural abnormalities. So these are the conditions when they will probably require a surgery.
So when you decide, okay, this candidate requires surgery, so what are some latest advancements that we are seeing today?
The spine surgeries have evolved in a big way. Now what we are doing is microdiscectomies, and recently we have started off with endoscopic discectomies. So the spine surgeries have literally become less than 1 centimeter. That is, sub-centimeter surgeries have started. Yeah?
Isn't that fascinating?
Definitely, definitely. And more than fascination, it is like the patient can immediately go back to work. Soon after the surgery, in the morning, in the evening, you're back home.
The recovery is faster as well.
Yeah, it is very fast. And we also have navigation here, and we are able to put the screws and the instrumentation in the spine with utmost precision. So spine surgeries are precision surgeries. We have the latest advanced surgical equipments that have come, like ultrasonic scalpels, where we use ultrasound to actually cut the tissue, wherein you don't destroy the soft tissue or any other surrounding places. And though this is performed by a doctor or even by robots, we have something called as neuromonitoring, intraoperative neuromonitoring. It again sends us a signal. If we are too close to the nerve, then it just says us, hey boss, you're too close, be careful. So it gives us signal even before we actually go into any kind of a danger area. So these are the advances that we have it in our armamentarium.
So basically, each and every step from the time the patient enters the hospital or the OT, it's taken care and it's very carefully done.
Yes. So if you see, initially, like many of the patients are like, oh, spine surgery, it is a risky surgery. I might not even get up. అయ్యో కాలు పడిపోతాయి సార్, చేతులు పడిపోతాయి సార్, నాకు స్పైన్ సర్జరీ వద్దు. అసలు ఇప్పటి నుంచి అసలు ఆ భయమే అక్కర్లేదు. Our spine surgeries have evolved, and our spine surgeries are safer. And the third thing is, and the most important thing is, the spine surgeons at our place are even more better equipped and better knowledgeable and even more skilled than what it used to be.
I'm sure most of us are going to change the mind or change the perspective towards spine surgery after listening to you, doctor, for sure.
Sure.
So if there's one thing, spine would be begging us every day not to do, what do you think that one thing it would be telling us?
I would tell you 4 things. Okay. The first thing is, do not lift weights which you are not used to. The second thing is, give your spine a break. Okay. Driving for too long, sitting for too long, or even working out for too long. Yeah. So give it a break. And the third thing is, do not be a couch potato. Do not rest your spine always. And the fourth one is try being active. And if you can do sports on a regular basis, even that is good. But before that, stretches again.
So thank you, Dr. Madhu Kiran sir. It was wonderful interacting with you. And thank you for such an informative podcast. We thoroughly enjoyed this.
Thank you, Dr. Lakshmi.
So before we wrap up, is there any message you would like to tell our viewers as far as spine surgery is concerned?
Spine surgeries are safe surgeries, provided when done by the right hands.
So this brings us to the end of this episode. Hope this episode was informative, and don't forget to tune in next week as well. Until then, take care and stay healthy and keep moving. Thank you.